With growing popularity and usefulness of pulse oximeters, people are now using a pulse oximeter at home to monitor their blood oxygen levels. In this video we will give you helpful tips on how to use a pulse oximeter at home correctly to get accurate results. First, let's go over factors affecting pulse oximeter accuracy. Incorrect positioning of the finger. The finger should fit comfortably. It should not be too tight as it may restrict blood circulation. On the other hand, it should not be too loose for the device to fall off or allow outside light to interfere with the reading. Nail polish on fingernails or long dirty fingernails. Nail polish or dirty fingernails can absorb light emitted by the pulse oximeter and affect the accuracy of the reading. Movement of hand while taking the reading. Movement of hand or shivering can result in an inaccurate reading. Cold hands and low blood circulation. Cold hands and fingers mean that the blood flow and circulation to your hand is low and may cause difficulty for the oximeter to detect a good pulse signal. Current tobacco use. A person who smokes heavily might cause their oxygen saturation to be measured 8% higher. Skin thickness and skin pigmentation. It has been found that dark skin or high pigmentation skin can result in overestimation of oxygen saturation, especially at low saturation levels. Direct bright light. Direct bright light in the room or bright sunlight can interfere and result in an inaccurate reading. Tips for accurate pulse oximeter readings. Always follow instructions from the device manufacturer. Take the reading preferably sitting. Make sure your hand is relaxed, warm, and below heart level. The hand should be steady and in a resting position. Remove any fingernail polish on the finger you're reading. Insert your finger into the device and press the button to start taking the reading. Wait at least 30 to 60 seconds until the reading stops changing and displays one steady number. Interpreting the pulse oximeter reading. A pulse oximeter reading is an estimate of blood oxygen saturation. For example, a pulse oximeter oxyhemoglobin saturation (SpO2) of 90% may represent an arterial oxygen saturation (SaO2) of 86 to 94%. Normal oxygen levels are at least 95%. Some patients with chronic lung disease or sleep apnea can have normal levels of around 90%. If your SpO2 level is less than 95%, you need to visit a doctor, as it may be an indication that you may be suffering from hypoxia, a condition that requires observation and treatment. When possible, make diagnosis and treatment decisions based on trends in pulse oximeter readings over time, rather than absolute thresholds. Do not rely only on a pulse oximeter reading to assess your health condition or oxygen level. If you are monitoring your oxygen levels at home, also pay attention to other signs or symptoms of low oxygen levels. Difficulty in breathing. Bluish color in nails, face, or lips. Faster racing pulse rate. Tightness or pain in the chest. A cough that gets worse over time. We hope these tips will make you confident in getting accurate readings at home with a pulse oximeter. For related articles and updates, look at the description below. We hope you found this video useful. Please smash the like button and subscribe to keep connected. Thank you.